Hey guys, welcome back to my channel. My name is Abba in case you guys are new here, and today we are going to be talking about, yes, you named it, the coronavirus. Everyone on this planet has been freaking out about this virus because it's been on the news, it's been hyped up quite a bit, I feel like. And I just want to give you some accurate facts about this virus. I also want to talk to you about the travel situation, how it spreads, what's going on with the drug development. And I also want to talk to you guys about how healthcare personnel are taking precautions, what is required of them. I want to give you guys like a student's perspective. As someone who does go to the hospital 3 times a week, I felt the need to kind of discuss this. I'm sure some of you watching this are either planning to go into healthcare, or even if you're not and you just want to know more about this virus, what is actually really going on. Please continue to watch this video, and hopefully this will give you some clarity as to what you should be doing in order to prevent yourself from getting this virus, because it is highly contagious. And I do want to talk a little bit more about the science and, like I said, how it spreads and what hospitals are doing with students, what hospitals are doing with their workers and stuff like that. So basically, coronavirus, as you have heard, is a respiratory disease, right? And basically the symptoms are very, very vague. They are like your everyday flu symptoms. And it was originally discovered in Wuhan, China. The outbreak kind of happened in December of 2019, hence the name COVID-19, because the D stands for December and 19 for the year it was discovered. So there's really not much known about this virus. There's different strains of this virus. And the current strain, which is going around at the moment, I feel like is the most contagious out of all of them. That's kind of what I've gathered from watching reputable YouTube sources, which basically they also like refer to websites like CDC and stuff. Like I watched Dr. Mike's video because he is a board certified physician. I felt like his information would most likely be the most accurate, and I did go to the CDC website myself and I looked this up and things like that. So basically was discovered in China. It has been going on ever since then, ever since December. Recently it's gotten pretty bad. It has led to a lot of deaths in China and some other countries, which we'll talk about in a little bit. For those of you who are, not from a science background, I do want to talk about how infection in general spreads and how viruses are different than other forms of infection. This is just like general knowledge. Like I'm not going to go into like super duper scientific details. So basically we get infected with different microorganisms, and there are bacteria, there are fungal infections, there are viruses. And viruses generally are very, very difficult to treat. Now, we do have certain bacteria from certain parts of the world which are completely just very, very deadly. Like they will kill you. In case you guys don't remember, from like 3-4 years ago, Ebola was going on, the Ebola outbreak. That's a really deadly one, deadly bacteria. So certain infections are deadlier than others. In terms of coronavirus, they are saying that it is an animal source, like that's where it originates. They don't actually know what particular animal. Like there's debates about that too. Some are saying bats, others are saying dogs. So we don't really know what exact animal that they're talking about. And oftentimes, basically, like I said, viruses are, a little bit more difficult to treat. And in the case of coronavirus at the moment, like the CDC which is known as the Center of Disease Control, in case you didn't know that, and the WHO, which is the World Health Organization, is currently working on a vaccine. However, the chances of like actually having a vaccine at the moment is really, really low, because it does take time for this vaccine, for any vaccines actually, I should say, to develop. The chances of it just being ready like in the next month or the next couple of weeks, super duper low, you know? In terms of like drug development, they are also working on that, you know? There's a difference between a vaccine and a treatment like drug. Vaccines prevent you from getting this virus, whereas drugs would actually treat when you have contracted the virus. It might take about like 1 to 2 years for a drug to be developed, and a drug has, in order for a drug to be out there in the market for providers to prescribe to you, it takes a really, really long time. It has to go through a lot of different processes, and it has to be FDA approved. So they'll do like trial 1, trial 2. There's different stages that they have to pass, and then they also have to be tested on animals and humans. So it's just a really, really long process, and it will take time for sure. At least that is what the members of the CDC are currently saying, is that it will most likely take some time. Now, how does this virus spread, right? So like I said, it is highly contagious. It is contagious like measles, or more contagious than your normal average everyday flu. And basically it spreads by close contact, person to person, and via respiratory droplets. Now, what that means is that, let's say if you just sneezed out, you know, there are droplets from the sneeze coming out, and you as another person gets in contact with the sneeze portion, like the droplets, you most likely will also be infected with this virus. A lot of people have allergies. I myself have a lot of allergies, especially during the spring and winter time. Initially, it used to be like watering of the eyes and me just sneezing a lot. Now it's just come down to me sneezing, not as much watering of the eyes, and it's just honestly to dust. Anywhere wherever it's dusty, I probably will start sneezing. But yeah, a lot of people have allergies, so that's another reason as to why this, you know, virus is spreading, especially this time of the year. Like I said, winter and spring are the times when most people have these allergies, seasonal allergies. So that's another reason as to why many people are getting it. Another thing I've just noticed in the media at the moment is the fact that they're kind of just like hyping up the situation, and they're scaring people. Many people have flu, and many people suffer from it, whether it is coronavirus or not, but very few people die from coronavirus. It's really about like 1 or 2%, the mortality rate. It's really, really not that high. The only problem at the moment with this virus is that it's spread so quickly. So I kind of just want to talk to you guys a little bit more about who really is most likely to get infected from this virus and actually have some severe symptoms. And it's mainly people above the age of 50 who should be a little bit more concerned about their health, and other people like immunocompromised patients or someone suffering from a chronic illness. I don't think there is much information available for pregnant women and infants. There's really nothing that we know at the moment. But most of the cases where people have passed away, most of these patients are immunocompromised patients, patients who suffer from chronic illnesses such as COPD, diabetes, heart issues, etc., etc. and most of them are elderly. Like most of them are in their 70s, 60s or above. So what the CDC website does say is that if you're above 50 years of age, then you probably should be a little bit more concerned. So that's something I feel like the media just doesn't really mention, is that a lot of these victims, they are much older. And I'm not trying to say that the chances of you getting infected from this virus is very low. If you're like not in that age range, no, that's not what I'm saying. You can still get infected if you're like my age, I'm 25, or 6-7 years old, and you can still fight this virus. It's just a little bit harder for someone over the age of 50 and someone who's immunocompromised to fight this virus. So let's say if I get coronavirus at the age of 25, I probably would stay home, have flu-like symptoms, and then recover. With a lot of younger people who have gotten infected with the coronavirus, they are doing fine. Like they are able to recover once they have gotten infected with the virus. So it's, like I said, it's mainly the immunocompromised and older adults. Okay, so I do want to talk a little bit more about like the travel stuff and what kind of has been going on with that and what the US is kind of doing at the moment. Oh, the light just keeps coming in and out of here. But anyways, with respect to other countries, like currently they're putting, I wouldn't say like a travel ban, like it's more like go at your own risk. I'm pretty sure China is just not letting anyone in and out. But for the other countries, it's more like just go at your own risk. And even like, the government, like the US Department of Immigration and all of those types of websites, when you're applying for your visa and stuff, you know what I'm talking about. So like those travel websites, official government travel websites, over there, they kind of have in red, like on the top, like do not travel right now, like just don't go, especially to X, Y, and Z countries. So they're just really putting a warning. And especially like I know here in the United States, like if you're an international person from any other country, like right now, it's just kind of just go at your own risk, and there's no guarantee if you would like be let back into the United States with this whole situation kind of going on. So like I said, China, Iran, Italy, and South Korea right now are level 3 warning. So they're like, just don't go to these countries right now. They've had the highest number of cases. They've also had mortality rates. It hasn't been as high. Like I said, the mortality rate with this coronavirus is not as high. That doesn't mean that people are not dying. They, of course, passed away. Like the people who are, like I said, immunocompromised, really elderly as well, or they're suffering from like chronic illnesses. Like most of the cases, especially in the United States, or the ages that have been reported are around 60, 70, something like that. So that's kind of the situation right now around the world. And in terms of US, as you guys must have noticed, that a lot of states have declared state of emergency. Now, state of emergency honestly kind of just depends on what state you're in. I know they added like New York, maybe Maryland. I think New York and Maryland. So today's date is the 7th, FYI, when I'm filming this. So they added New York and Maryland, like I said, to the state of emergency list. And also there has been like increased reports of confirmed cases in these states as well. And I also just read an article on Utah, but some of these news articles might be just not providing the right information. The CDC does updates like every day, but they really haven't been updating the US map of the confirmed cases and stuff like that very much. I feel like they're a little bit like overwhelmed. They're trying to develop the drug and get the vaccine like super quickly because, you know, the cases have been increasing. So I feel like they really haven't been, you know, actually confirming cases, or sorry, updating cases on their website. And it looks like there might be more cases in other states and they just have not been reported or updated on the website. So it looks like New York, New Hampshire, not New Hampshire, but Utah and also Maryland are 3 additional states which have declared state of emergency according to the news right now. The situation in the US, like there are some states where traveling is just like, you know, not advised, especially like LA and Seattle. Those are 2 cities right now where it's like, just don't go there. Like, just don't go there. Recently, so I do want to talk a little bit more about my university and like what kind of has been going on with like my school. I'm not going to declare my school. I'm just going to tell you like what they have said, although some of you might even know like where I go to school, but yeah, I'm not going to like declare the name and everything. But basically with my school, it's been a topic of discussion. I mean, it has been a topic of discussion anywhere really, but they really have been avoiding or telling people to just avoid international traveling. So like they have canceled all official school travel abroad programs, and we do actually have spring break right now, so they like canceled all of that. They are not letting any foreign speakers at the moment come to speak at our school. That has also been completely canceled. They were really just talking internationally until yesterday when I got an email saying that now they're being very, very cautious with you just leaving Northeast Ohio. Which is crazy to think about, and it's just so weird because we do have spring break. So many people had plans. Everyone had to, you know, cancel their plans, and everyone is in this hysteria of like, oh my gosh, like I can't do anything. I'll be stuck in one place forever. And you guys, I go to a pretty big school. Like there's a lot of like schools here in Cleveland, and we have a lot of international students and also like people from different parts of the US. Everyone is not from Cleveland, you know, and it just kind of has been a little bit crazy. We have to like, you have to like register with the university before leaving, and this is just like precautionary, of course, but you're having to just register with our school's health department. So that's something which is really new. Like I don't think in the history of me being like a student, I don't think that has like ever happened, like ever. I've never had universities like actually be like, okay, you gotta like register before you leave just so we can track you, and if we know that you're coming from like, you know, a state where there is a state of emergency, we will be very cautious with you and stuff like that. I don't really know the situation at the airport of Cleveland, like Cleveland Airport. Like I don't really know what precautions they are taking, but that's kind of what has been going on around me. And I'll talk a little bit more about like the hospital situation. I'll get to that, but yeah, they're just being super duper strict, and I don't really know right now if there are any confirmed cases in Ohio. Like I don't really know of any. There has been a lot of suspicion. Unfortunately, we don't have a lab here in Ohio, Maine. I will post a picture when I'm like editing this video. Like there are some states which actually have the lab and the testing services immediately available to them. As of now, from what I'm aware, Ohio doesn't have that, which is super duper strange because we have so many hospitals here, and hospitals are working hard to develop some of these tests, but I feel like there's just a lack of resources at the moment, like limited resources, and that's why we're not able to probably even test in Ohio. We might even have to send our samples. Hey guys, it's another day and I look totally different, I know, and that's because I'm just wearing minimum makeup. It's early in the morning, well, not really that early, mid-morning, I guess I should say. And today is March 8th, and I think I stopped the video just talking a little bit more about, traveling and how travel has been restricted internationally and also domestically as well. Certain states, I think I already mentioned it in the other clip, so I'm not gonna go over it, and I'll link all of the travel restriction important links that I was able to find in the description box in case you guys are wanting to travel to different states. You can go, check those websites out. But yeah, there were, I think, 16 states now. I think it was initially like 13 or 11 or something, and now it's 16 states which have confirmed cases of coronavirus. Don't quote me on it, but I think it's 16. So basically, I kind of just wanted to give you guys like a perspective as a student in healthcare, like what kind of has been going on in my mind, how I'm affected by it, how they're taking precautions in healthcare. So I just want to talk to you guys a little bit more about that. And definitely my university declared that if you're traveling outside of Northeast Ohio, you need to register with the university so they have a track of where you're actually going. And just to be safe, like there hasn't really been confirmed cases in Ohio yet. Yesterday I did watch a video from the health department of Ohio, like the press conference, and there hasn't been any confirmed cases until now. I think Indiana has one confirmed case. I could be totally wrong, but there's just like mixed communication about the number of cases and all of that. And the CDC website actually hasn't really been updating the number of cases as well. Like I feel like they're a little bit overwhelmed and they really just have not had time to keep the updates going on, because it seems like, I knew about Maryland having confirmed cases a really long time ago before CDC actually put it on the website. It is kind of questionable right now. I think CDC is a good, reputable website, but when I go to different websites of like different states, that's when I'm like getting the information. So it's not all in just one website, if that makes any sense. Like I would have to go to the state of New York's website, the Department of Health, and state of Ohio Department of Health, and Maryland Department of Health, and yeah, just going to different websites rather than just relying on CDC. That's definitely one thing I learned while doing research. So yeah, I do want to talk a little bit more about like how it has affected me as a student in healthcare, how hospitals are taking charge of the situation, what they're doing, what they're planning, and stuff like that. So of course, any student who is either a medical student or a nursing pre-licensure student like me, or even an MSN, a nurse practitioner, or APRN student, you are just not allowed to deal with these patients. If you do come in contact with these patients, you're supposed to immediately tell your preceptor, your supervisor, whoever that is, and then they have to basically like evacuate you from the particular location where there is a confirmed case, whether that is a nursing home, whether that is a hospital or a primary care office. Like you just have to evacuate those places. In some cases, like let's say if you are a nurse practitioner student and you're already working as an RN in the unit which is handling these patients, then yeah, you most likely will have the N95 mask, and at that point it kind of becomes your job to deal with these patients. So it just depends. If you have that license and if you're already in your work setting, then you can handle these patients because you're fitted for that mask. And when you're doing your nurse practitioner preceptorship, then no, you're not supposed to deal with this patient. Really strange, but that's kind of what the email said about my school. And I talked about leaving the hospitals and what they're doing right now, because we're so close to graduation. For a lot of different programs, they're really just trying to cut down the hours that we have to put in hospitals. So they're working with the Ohio Board of Nursing, Ohio, other boards with other healthcare professionals, to cut down those clinical hours. And like I said, students are just not to treat these patients at all whatsoever. The precautions that we're taking right now, we are treating them as airborne, droplet, and standard, at least at the hospital that I do my clinicals at. So airborne basically is the precautions that we take for our TB patients. And every time there's an airborne precaution, we as students usually don't deal with that, because that involves having that, like I said, N95 mask, and we can't go into those negative pressure rooms without that mask, and you have to be fitted for those masks. And as students, because we are moving so often from hospital to hospital, we are not fitted for those masks. So that's what is the situation. The situation in Ohio really hasn't been that bad that I know of. Like, I did go out yesterday, and at the restaurant, like, there were very few people, which is totally understandable, because they're telling you to avoid going out and stuff. So many people did take that and are taking responsibility if they're sick and stuff like that, just not going out. Shopping yesterday as well, and it's not like we were out of stuff. Like, that wasn't really the case. So it's just not really that serious in Ohio like it is in like LA, Seattle area, and also like New York. I feel like it's more because those places have larger cities, at least larger than Cleveland anyways. So that's why it's more of a concern there. More people, more international people. We do have a significant amount of international population, but because we've done like the travel thing, a lot of people are not really able to leave and or come in as well. In terms of canceling clinicals and universities, I don't really see that happening, at least now, because we don't really have any confirmed cases, and we also have spring break, and you never know like what's really going to happen like after the 7 days, like after the spring break is over. So that's so far the plan. Like, we are still having regular classes. Like, it's not like we have to completely cancel out classes. They're just like telling people to be mindful of where they're going, and also just like registering with the university if they are gonna leave like Northeast Ohio. I'm not leaving Northeast Ohio. I'm still at home, and the only thing that I have planned for this spring break is to go camping, and there will be a vlog on that, but that's still in Northeast Ohio. So I'm not really like going to like airports and areas, like heavily populated areas like that. So that is it, you guys. That is all the information that I was able to gather. And I kept saying COVID-19 is the virus, I think, in this video, but SARS is the actual name of the virus. Please be safe in whatever state you're in. Let me know down in the comments below what the situation is in your state. Have your classes been canceled? What do you think will happen? I honestly can't really predict anything. I don't think anyone can really predict what would happen, but I'm hoping that by the time April comes around, the cases not cases, but like just the virus does die out. Like, we don't really know what temperature this virus like thrives in, but I'm just really hoping that by the way, I keep doing that because my allergies are kind of bad today. I apologize for that. Yeah, it's just, you just don't really know. It's kind of difficult, and to know. I feel like the cases in China, from what I've heard, have gone down. Like it's calmed down quite a bit. Also in South Korea and Japan as well, from my understanding. But here in the United States, I really don't know what will happen. So let's pray that, you know, with the temperature going up, like with it becoming warmer, the virus just dies out. So thank you so much, you guys, for watching. And like I said, let me know down in the comments below your thoughts, and I will see you in my next one. Bye, guys.